It's October 1st. That makes today a very special episode of the Maximize Your Medicare Weekly. I know all the details about Part D and Medicare Advantage coming into the new year. I'll give a sneak preview coming up next. Okay, everybody, I've got a flash even before midnight today, which is September 30th. In a few hours, I'm going to have the full details. I'm going to give you a sneak preview about what is going to be happening on Medicare.gov with respect to Part D plans. I'm going to give you a quick survey as well as among Medicare Advantage plans. However, this is actually almost incredible. So what has happened is there's something called senior savings model, and this is very important to people who depend on insulin, which is, for diabetics and people who don't know, diabetes, certainly an epidemic in the United States. Anyway, the important thing about this model is the fact that if you get this $35 cap on insulin, it entirely will change everything about the way that you select a Part D plan and the way that it would guide you to selecting a Medicare Advantage plan. All right. What I've been told that in a few hours that this full calculations are not going to appear in Medicare.gov. Let me repeat that. Your total anticipated cost, the entirety on which we would be basing our recommendations, is not going to be accurate on Medicare.gov. This is a huge problem. Huge. It basically has tripled, quadrupled the number of hours it will take us to work through the best plans on Part D and Medicare Advantage. Okay? So I can't stress it enough. Persons who have already reached out to us and are in our already long queue to get our free Medicare consultations, that is now triply urgent. The links are there in the text on this video. But again, the numbers on Medicare.gov are going to be wrong. You need an expert to suss it out. You needed an expert before. That's just the candid reality. Okay. But especially because of this, and I've posed the question to carriers, which is, hey, have you hijacked money from the rest of Part D in order to push down to increase your participation in the $35 a month cap on insulin? And I'm getting radio silence. They're not answering this question. It's a tough question. Don't get me wrong. This is an advanced question. And the fact that, other me's in the world don't know what I'm talking about, this should tell you something about how complicated this stuff is. When you're making the mousetrap, there are a lot of different pieces here. And this is going to be my number one concern. I'm not very happy is the candid reality, because they've literally tripled or quadrupled the amount of work that's going to be done this year. All right. We'll see you in a couple of hours. That'll be the next segment where I'm going to take a preview of Part D and Medicare Advantage. See you soon. Few moments before midnight, and I'm going to have the alarm go off and it's going to tell us at midnight. Then that means that we're going to be able to show you, what's going to be happening for 2021 Medicare. What I'm going to do is I'm going to put in a couple of zip codes and different drug lists. We're going to check out what the plans look like for 2021. I'm going to be pointing out some certain tips. You need to watch the prior segment where I pointed out a particular problem that's going to be showing up here under insulin, where, it's not going to be correctly added into the total costs. Today, what I'm going to do is just give you some guidelines. This is not specific advice for you. Okay, it's very important. It's just to give you some guide on how I'm going to be looking at things, how I'm going to be, checking them out for clients. If you want my private free consultation, you can go to the link that's sitting there in the text under the video. It'll be there, as soon as I post the video, which will be sometime, I don't know, 2 o'clock Eastern time in the morning, on October 1st. So you may wonder why I'm waiting until the hour of midnight is because there are regulations. There are all sorts of regulations around me. I won't, violate my fiduciary responsibility to you. The fact of the matter is that I get paid on commission by the carrier. And the reality is I have no idea what the differences are. It does differ from state to state, from carrier to carrier, especially when it comes to Medicare Advantage and Medigap. We won't be talking too much about Medigap today because the fact of the matter is it does not really revolve around a calendar year. There are price changes that happen to Medigap premiums. They happen year round. They don't happen at the same rate across all of the different carriers around the country. That will depend entirely. And there we go. There is my alarm. And so what we do, this is Medicare.gov up there on the screen here. And what I do generally is I just go to find 20, and we'll see whether or not they're going to actually change it. And hopefully this won't be the shortest video on the planet. So today I'm not going to be creating an account. People can do that, create an account, and you can share it with me on Zoom, where I can take a look and try to guide you here online as if I'm there right next to you. But for today, let's just go to continue with logging in. Now, the fact of the matter is that the website may not have even been updated because it's literally here at midnight. What type of 2020 coverage? You can ignore that for now. Let's just see what happens. And let's just go to Part D. And what I'm going to do is I'm going to enter a zip code, and let's just start in the middle of the country. So this is Chicago, Illinois, Cook County. And then I don't get any help from these programs. Now, it is important that if you do qualify for Medicaid or SSI, if you get extra help from Social Security, to correctly choose these if those do apply to you, because they will affect the way the calculation works here on Medicare.gov. But I'm going to just do it for someone who doesn't get any assistance and just move forward. You want to see your drug class when you put plans. This is fairly important. You need to put yes. And I generally put both here. And the reason I put both is because it gives you the maximum flexibility from whether or not you're going to go to your local pharmacy, whether you're going to go to a large chain, or whether you're going to order by mail order. The costs here are going to wildly vary from medication to medication, so you do need to be careful. So let's just go here to next. So what I'm going to do is I'm going to make up some drugs here, some medications that are very, very common, and some that are not so common, just to see what the effects look like. So let's just take one, lisinopril. There it is here. And note that if you have hydrochlorothiazide and lisinopril, that it's important to have the combination and not just, but I'm just going to start with lisinopril here. Whoops, let's just see if I can do this correctly. There we go. Add drug. And just let's presume this is the dosage. You can see you can change the dosage and you can change the quantity and by month, but let's just continue on with the generic and let's add a couple of more. So let's see, what else can we, let's just, let's call it latanoprost. These are eye drops for those persons that don't know, for persons with glaucoma, and just use it. And then let's just have it as, what is it called? Let's make it hypothyroidism. What's the name of the, hold on for a second here. Let's just make sure I can remember the name, because yes, just to call levothyroxine sodium. I've only done this 5 million times, so of course, when I hit record, I forget the name. There it is, and sometimes 88 mcgs is the very common amount. So let's pretend these are our 3 medications. This is not a real person. I just made up these medications commonly known, And let's just go on to done adding drugs. So there's your zip code, and what you need to do is you need to add your pharmacies. Now Medicare.gov has changed because they now allow you to have 5 total pharmacies. What I generally tell persons is to make sure you have a national pharmacy in there somewhere. So I just chose CVS. I'm not a proponent of CVS above all others, but just wanted to take a look at what the survey would look like. And Walgreens, there's one that many people know. Let's see what else here we've got. There's one other in Chicagoland. Let's just see if we can find it here. Planned Parenthood, no. CVS, no. And of course, as usual, the names are escaping me here as we're scrolling down. You can see that you can choose and you can add whatever Osco drug. There you go for Chicagoland. That's a specific one for Chicago, and there we go. So you can see here on the bottom row, I'm drawing my arrow around it, the four pharmacies, and then we click done. So what's happened here is this shows the medications in the order of lowest drug and premium cost. And this is the total amount here. And what this does is this sorts it in order. Now, you need to be careful. You need to be careful because this is based on some overall estimates. And what I'm going to do is I'm just going to compare here, and you're going to compare a few plans by different carriers. I'll do one here, Mutual of Omaha, RX value here, and we're just going to compare. So you can see it here. So people try to look at the premium. That's natural because that's the one that everybody recognizes. But really what you're trying to do is we're trying to have the lowest overall total cost. And you can see some differences as we continue on. And you can see it here. Estimated drug and premium costs here, $37, $117 for standard in-network. So all of these, you can see it here, that CVS is the previous and Osco are the preferred in-network here. Okay. CVS and Osco are preferred in-network here and mail order. And again, and now in this one over here, Mutual of Omaha, CVS, but Osco is just the standard in-network. And you can see its costs are much, much higher, even though you can see that, it is much lower here at these others. So the plans all can be accepted at Osco in this particular case, but in this particular plan, in this particular instance, right, it would actually result in a higher out-of-pocket cost if you use this plan and Osco. So, and you can see the same thing that it says in network, but you can see that the total costs here are notably higher than under the preferred at other plans. So this is what makes tricky for Part D. Okay, this is what makes Part D tricky. And you can see, actually, this is kind of a bummer because Medicare.gov isn't exactly correct in the sense that it is not updated for 2021 as yet. Bummed out because the fact is that Medicare.gov has failed me yet again by not showing, the newest updated, even though, technically speaking, it should have been updated at midnight. So what I did here is I went to the next best thing, and you can see, this very large, this is the official Medicare spreadsheet of all the plans. And I went back to Illinois. You can see it here. These are the 2021 Medicare Part D standalone prescription drug plans. And what I did here is I chose the filter of Illinois, and you can see it here on your screen to the left-hand column. And let me just do a quick count for you. 31 plans in Illinois for 2021. So you can see what I'm saying. The exercise that I ran before for you, it sorted for you in the order from lowest overall cost to highest overall cost. It will do the same for you for these 31 plans when we have Medicare.gov working. What you see here, what can we do? We notice a couple of important things. Number one is you can see this column here I'm highlighting here. Remember, I was telling you that if you receive extra help, if you are on Medicaid, for example, then these plans here, if you have extra help, and they call it the low income subsidy, even though that's the old name for it, these plans with the X, they will result in a $0 premium for you. Second thing is you can see now that these plans, this is the range of premiums. And just to give you an idea, in the state of Illinois, it is possible to find plans as low as $7.30. And it ranges from that to $147.80. You can see the bottom line. There's a reason I wrote this book, Maximize Your Medicare, which is the fact that the wide range here, okay? If you are sitting on a plan and it's sitting at the upper end of this range, unless you're taking a very specific set of specialty drugs, then and only then, and even not even then, maybe you're on the higher end. But the reality, you can see, just let's scan up and down this column here, and let's just do that. You can see this. There are very few plans here, even above $50. There's 1, 2, 3, 4, 5, 6, 7, 8, 9. 1/3 of the plans are above $50 a month. So the reality is, unless you take a very specific set of medications, I'm always telling persons to check and double check. And there's your evidence, because this is for Illinois. And if we just change the state, let's just change it to neighboring Michigan here. You'll see it here. There we go. And now we've changed it to the same thing, the same list for Michigan. How many plans do we have this year in Michigan? We've got 29 plans in the state of Michigan. And again, you can scan up and down here in this column. Very few plans above $50 mark. 1, 2, 3, 4, 5, 6, 7, 8. 8 out of 29 plans, everyone. So you can see what my point is. If your plan has drifted higher in premium and you're taking generic medications, it may be that a change is in order. Again, can't call this specific financial advice. I would need to know a lot more about you that you can use by going onto the link in the bottom of this video. Now, let's just point out another thing here. You can see here the low premium sitting in here at $6.90. Now, I'm not going to say, because I've not seen your list, right? I would need to see what your actual list looks like. But the fact of the matter is that for those persons with trying to push down their premium, this does exist, just to give you a feel for how competitive the market is. Here is I'm going to switch. I went back to Illinois. This is Medicare.gov in front of you now. Remember the list with the 3 medications? What were they? Lisinopril, latanoprost, and levothyroxine. Those showed you the prescription drug plans. And I want to point out now, I'm going to switch to Medicare Advantage, because you can see up here this message here. There may be Medicare Advantage plans available with lower drug costs. So what you can do is you can switch to the examination from Part D to Medicare Advantage by clicking over here. And I'm going to highlight it here, and let's see, I hope I don't go there. And there it is there. I've highlighted on your screen there on the upper right-hand corner. View 46 available Medicare Advantage plans. Now, based on where you live, you may not have 46. Okay. If you live in Miami-Dade, you'll have more than 46. If you live in, I don't know, Lansing, Michigan, you will not have 46. Every location will be different. So there it goes. And what I've done here is it now is sorting these 46 plans. Now, it's pretty important here because this order is only about your lowest drug and premium cost. It is not taking your anticipated medical costs into account. So this is drug only, but I thought it still is very instructive. What you'll notice here, and this just sorted by the lowest drug and premium cost, as you can see me on the upper right-hand side of the screen scrolling. So what you have here is you have this anticipated yearly drug and premium cost. And you see it is 0. Now, this is not a misprint. Okay, first of all. It simply means that the premium to this plan is 0. And if those were your only 3 medications and you went to your preferred pharmacies, okay, then your drug and premium cost could be 0. And let's just see how that could possibly be. I'll click on plan details. You can see your premium is 0. You still need to be enrolled in Part B. That's the $144.60, which is the premium for 2020. And these are the details to the Medicare Advantage plans, all the different services and the costs. Now, I will get to some other punchlines, and we will get to them, shortly. And we'll go down here to drug costs. And you can see these preferred generics are at 0. If you're going in at a preferred retail pharmacy drug cost for 1 month, well, it just so happens that the ones that we chose, CVS, Osco, Walgreens, they're all preferred in-network pharmacies. So as a result, with this particular Medicare Advantage plan, then it's possible that your drug costs are 0 if you go to these preferred pharmacies, all right? Very important. It does depend on the combination. You cannot just presume, okay, I've got this Medicare Advantage plan. I'm going to go to any old pharmacy with those 3 medications, and then your costs are 0. Not necessarily. You need to be going to these specific pharmacies. Then in this particular plan's case, okay, and then and only then, as you can see, your preferred retail pharmacy drug cost for 1 month is 0. Okay. But it's not a misprint. And you can ask me why. And the reason for it is, you see, basically the way that I explain Medicare Advantage to people is the Medicare Advantage carriers are taking the 144.6. They're getting a per diem from the federal government, right? You've got to pay 144.6 to the federal government. Well, for every Medicare Advantage enrollee, the carrier, they get a per diem. It's like an allowance, right? And they're divvying it up across all of these different benefits here. And their combinations are all different from plan to plan for all 46 plans. That's the way it works. Okay, so as a result, you can see clearly what has happened here, which is this particular plan, they took their allowance and put it towards your prescription benefit, thereby pushing your costs down to 0. Not every plan is going to be the same. This is why I'm saying you can see the number of moving parts here. The number of moving parts here is enormous. That's why I say from year to year, does it make practical sense that your Medicare Advantage plan, the best one for you, the most optimal one for your combination of doctors, hospitals, medications, is going to stay the same year over year when all the sellers are innovating all the time? Not really likely. And it's like I try to explain whenever I talk on the radio. I tell people, look, do you stick with your 2016 Camry instead of your 2020 and 21 Camry, when your right to change costs you zero, you never do that. They're innovating. Not only they're innovating, you don't necessarily even stay with Camry, right? Because it's not like Toyota, Nissan, Hyundai that they're asleep at the wheel. No, they're innovating and watching their competitors too. Therefore, and you can see it, 46 plans in Cook County, 46 in 2021. We don't have the full, I'll show you the full details about Medicare Advantage in Cook County for 2021 in that spreadsheet in the next segment. It doesn't get away from the following, though. Again, the point that every time that I talk about Medicare Advantage, you have to understand network. You have to understand how these letters work: HMO, PPO. And the reason is that if you don't understand the network, then you may be hit with higher out-of-pocket costs than you have anticipated. Very, very important. Very important. That's not saying it's good or bad as a blanket statement. Again, not specific financial advice for you. In order to do that, I would have to know a lot more about your specific health and financial situation. All right. So now you can see what I did in the past is I took the Medicare Part D plans. I showed you how to compare. I showed you then the 2021 new list, right? We went to Medicare Advantage. We looked at how the fact that total drug costs could actually be lower under Medicare Advantage. Why? And it gave you that explanation. Now what we're doing here on this spreadsheet is taking a full look at the 2021 plans available in Cook County. And again, the same exercise is not really going to matter, or it's what I'm going to say is that the process by which we're going to look through, what's available, this is going to exist in most locations. The number of different Medicare Advantage plans or Part D plans is going to vary from location to location. As I showed you, in 2020, Cook County had 46 Medicare Advantage plans. And you can see this is the new list for 2021 here. And again, it's there. There it is, 2021 Medicare Advantage cost plans. So now for Cook County, as you can see here, let's take a quick run and see how many are going to be available for 2021. And what do we get? 52. So you can see what I've been saying, right? I wrote Max Marriage Medicare, and the biggest change from 2013 to 2020-21 edition is the fact that Medicare Advantage is far more viable now. The number of people who are enrolled in Medicare Advantage is going to approach 50% of the Medicare Advantage population. The CEOs from Medicare Advantage carriers basically all saying the same thing. And you can see it here. Now, and of course, most people are taking a look at the premium, and there you can see it here. Premiums ranging from $25, and those dashes are going to be zero. So a large number of plans that cost $0 in your location, right? Amongst these plans in Cook County now, and all of the different drug deductibles. And you can see here from the standard drug deductible of $445, that's the highest it can possibly be for any plan in the United States, across all of these, and the different types of benefits. Now, for me, when I'm checking out these plans, as I said, I said under the last segment, you need to understand the network. And here it is here, type of Medicare health plan, and here it is, local PPO, HMO. There's no shortcut. Unfortunately, there's no shortcut for you to checking out your doctors with the carriers at those plans. There is no shortcut to this. If you make a mistake, you can change your Medicare Advantage plan as many times as you want between October 15th and December 7th, the annual election period. The last one you choose will be the one in effect. And guess what? During Q1 of next year, you've got yet another single chance to make a change. So let's just say you made an error and you don't find out until January 3rd. You still have the right to make that change. Last thing here, which is that these drug deductibles, and if I take most importantly this last point, which is this column N, which is in-network maximum out-of-pocket amount. If you can stay entirely within the network, this number is an important number. And the reason it's an important number, the maximum out-of-pocket limit, is once you hit the limit, then the carrier pays for everything and you pay for zero. Now, it's important to know the caveats, right? This says in-network maximum out-of-pocket, in-network. So now you can understand why I'm telling you that in-network is so important, right? And if you don't know, let's just say, for example, you may need to go to a specialist and you have to keep bouncing around to specialist. Let's say you're a new resident in your location. You don't know who your medical providers are going to be. You've not identified them for whatever reason. And I'm not saying that's good or bad. I'm just saying for whatever reason, you need to understand the definition between HMO and PPO. I'll leave that with you. You can continue to read that and maximize your Medicare. Get help in selecting these plans. You can find my link. Lots of you aren't going to contact me. I get all that. And for that, I understand that there's a fair amount of public service in my messages in these videos. You can thank me by being sure to press the like and subscribe button at the bottom of the screen. I'm Jay. I'll be running through the 2021 versions of Medicare.gov when they finally have it operational. And then I'll go through other examples live, not from Cook County this time, but we'll select a different location. Thanks for watching.